Good day, everyone. I'm Pooja Joshi, your host for today's episode. In this session, we focus on a condition that is common yet often misunderstood: irritable bowel syndrome, or IBS. To help us navigate this important topic, we are joined by Dr. Chhaya Kumari, gastroenterologist, Shri Ram Aspatal, Kurukshetra, a respected expert in functional gastrointestinal disorders. Today, Doctor will walk us through early symptom recognition, simplified diagnostic approaches, and effective evidence-based management strategies for IBS in routine clinical practice. Doctor, thank you for being with us. Let's begin our discussion.
Namaste. My name is Dr. Chhaya. I am a consultant gastroenterologist and hepatologist at Shri Ram Hospital, which is at Kurukshetra. And today we are going to discuss about IBS management.
So, doctor, question for you is, what exactly is IBS and how would you describe it in simple terms to a non-specialist?
IBS can be simply described in 3 words. That is a very common problem. And the second is that it's a chronic problem. And the third is that it's a general gut disorder. So when the problem gut disorder that is not affecting your daily lifestyle, but still you are uncomfortable with the gut in the form of abdominal pain, cramps, and bloating, and alternating bowel habits, which is lasting for more than 3 months, then you should suspect IBS.
Is IBS really a stress disease, or is there more to the story?
Definitely, there is more with the story. It is not just a stress disorder. IBS is something that is related to gut disorder in the gut motility and the sensitivity, and stress is one of its trigger factor. There are multiple trigger factors that affect the gut motility, which includes your dietary habits. There are certain food sensitivities that triggers the IBS symptom. Sometimes even taking antibiotics for long period affects your leads to IBS. Then IBS is linked to linked to some of the changes in the gut microbiome. Sometimes when non-healthy bacteria set in your intestine, then this also leads to IBS. Definitely, stress has a role. Stress is a very important trigger factor that leads to the symptoms that you see in IBS.
What are the top 3 red flags that make you suspect IBS in a patient?
The top 3 red flag sign is when, first of all, when the patient is complaining to you that I have all these symptoms for a long period and that is not affecting your day-to-day activity. It is just acting like a discomfort and the patient is able to do his daily activities, then that point only you start suspecting IBS. The second red flag sign is when the patient complains of alternating bowel habits. When he says that the bowel habits keep on changing, sometimes he gets a smooth, regular passage of stool, and sometimes the stool passage is not that much regular. He gets somewhat relief in his symptoms of bloating and pain abdomen after passage of the stool. At that moment, you should start suspecting IBS. Then when suspecting IBS, you should always look for the red flag signs. Whenever you have these red flag signs, then you should always do a thorough investigation. It is not IBS, something else, like presence of blood in the stool. When the patient is not able to sleep in the night properly because of these symptoms, he's having fever associated with it, which is running for long, then you should definitely consider other differential diagnosis other than IBS.
What simple screening questions can a consulting physician ask to suspect IBS?
The question should start with how much severe is the symptom. If the patient says that these are mild, then you should suspect IBS. Then next you should ask about his bowel movements. If he says that the bowel movements are alternating, then you should start suspecting IBS. then you should then the leading question should be that whether he gets relief with the whenever he has a good bowel movement. If he says yes, then definitely you should start suspecting IBS. Then absence of red flag signs with the bowel movements, with the abdominal symptoms like cramps, bloating, and cramps, bloating, and with somewhat little symptoms like nausea. When there is no trigger sign associated with it, then also you should start suspecting IBS.
How important is the patient's history compared to investigations in IBS diagnosis?
IBS, for the diagnosis of IBS, we do not have any definite investigations. The investigations are done only to rule out some other organic disease associated with IBS, like celiac disease or any kind of allergy, or there is associated IBS. So when there is no investigations for proper investigation for diagnosis of IBS, we are left only with a proper meticulous history that can lead us to the diagnosis of IBS. So history definitely has a very important role. The key questions in while taking the history is to ask for any alteration in the bowel habit, for the intensity of the pain, abdomen, and cramps, and how much bloating the patient has, and does he get relieved whenever he passes stool properly. And then you should then these are the important clues in the history that lead us to the diagnosis of IBS.
How do you apply the Rome 4 criteria in day-to-day practice? Can it be simplified for general physicians?
So it's a very good question. Rome 4 criteria are the criteria for functional GI disorders. So for the general physician, to take it in a simplified manner, you should always look for the duration of the complaints. If it is lasting for more than 3 months, then you should start suspecting IBS. And whenever the patient then you should look for 3 to 4 criteria in which we take in Rome 4 criteria are pain abdomen, which is not affecting day-to-day activity, the change in the consistency of stool day to day, and the third thing is that the patient is getting relief after passing stool. So this is the simplified form of Rome 4 criteria, which a general pediatrician can take for making a diagnosis of IBS.
How often do you see IBS overlapping with anxiety or depression, and how do you address it?
The overlap of IBS with anxiety and depression is large. When compared to general population, half of the patient of my IBS patient suffers from depression and anxiety. It is related to the disorder in the gut-brain axis, which has a definite role in the role in causing IBS. So about in IBS patient, the anxiety part is more. About 1/3 of my patient suffers from anxiety, and about 1/4 of the patient suffers from depression. So this is related to the gut-brain disorder. Whenever you are stressed, you have anxiety, the pain sensitivity of the gut increases, and that leads to the symptoms of the IBS. So while managing IBS patient, you should always take care of these symptoms. And when multidisciplinary approach is taken, and these psychological problems are also taken care along with the constipation and diarrhea part, we get the results. A proper result and the patient satisfaction is achieved.
Once IBS is diagnosed, what is your first-line approach to management?
So the first line approach when I start suspecting IBS or definitely diagnose a patient with IBS is to start with patient's education. So patient educations include dietary changes and lifestyle modification, and along with that, we categorize the IBS patient into whether the patient is constipation predominant, diarrhea predominant, or mixed type. So in the dietary part, we start patient with a low FODMAP diet, in which all the high fermentable carbohydrate things are removed from, and patient is started on soluble fiber diet, which includes isabgol. Isabgol has a very good role in the management of IBS. Then in lifestyle modification, we encourage patient to to do a regular physical activity of at least 1 hour 1 hour per day, and then a proper sleep hygiene is maintained, in which the patient is asked to take a proper 7 to 8 hours of sleep per day. And in the management of the subtypes of IBS, if there is constipation, we start with laxatives. If there is diarrhea, we start with drugs accordingly. And in the mixed type, we start with drugs that manages both diarrhea and constipation.
How do you tailor treatment between IBS-D, IBS-C, and mixed IBS?
The management in IBS-C, the focus is more on laxatives. We regularize the bowel movements with the help of the laxatives like polyethylene glycol. In diarrhea type, we decrease the gut motility by using drugs that temporarily halts the movement of the excess movement of the gut. Then in case of mixed type, we add both of them according to the predominant symptom. There is role of probiotic in all three types, so we add probiotic in all the three types. The role of antibiotic comes more in the diarrhea type, like the most commonly used antibiotic in IBS is rifaximin, which is more used in IBS-D type. In C type, rifaximin is only used when the patient complains of bacterial overgrowths
The most common mistake you see in IBS management?
The most common mistake in IBS management is relying too much on supplements, that relying more on the drugs. Drugs has definitely a role in management of IBS, but the other aspects that leads to IBS, like stress management, the psychological part, that has to be taken care of. Then the lifestyle modifications that we discussed earlier, like regular physical activity, is a must to insist to the patient so that we get a better result. Then the other mistake that we do is that consuming not doing the dietary modification. If the patient is consuming too much of sugar and processed food, then and your diet is going along with these, the results are not going to come. So you have to take care. You have to do a proper dietary counseling to the patients. You have to do a proper lifestyle modifications in the patient. You have to take care of the sleep hygiene, and when we take care of all these things, then only we get a result in the management of IBS.
One food you tell IBS patients to avoid?
So not only one food, there are many, but if only one food you are asking, then it is dairy products. If you're not sure that your dairy product is from a good source, you should always avoid it.
One myth you'd like to bust about IBS?
There is not only one myth, there are many, but if there is, I will just take note of only 2 or 3. The one common myth about IBS is that it's a stress disorder. It is not just a stress disorder. There are other factors also that leads to IBS. The second common thing is that it's untreatable. It is not so. If you get proper treatment, if you have get a proper treatment, like a holistic approach is approached for the IBS, then you definitely get treated. And the third thing is that third myth is that IBS is same as IBD. No, IBD is something different. IBS is just opposite to IBD. While IBD is a organic disorder that damages your intestine, IBS does not damage your intestine. It does not damage your system. It's a functional disorder. It affects your lifestyle, but it does not lead to inflammation or cancer-like thing. But IBD do cause it. So these are some of the myths about IBS.
One word that describes a typical IBS patient journey?
So one word that typically describes an IBS journey is that it's an unpredictable disease. So unpredictability is a word that suits most with the patients who are suffering from IBS. They don't know when the symptom will arise, what food will affect them, what kind of lifestyle will affect them, when will they get the symptom, whether they are at home or in journey or someplace. So one word, when will the bowel habits will change again. So one word that describes IBS is unpredictable.
What's your gut-friendly morning habit?
So a gut-friendly morning habit for IBS patient is that you start your day with a glass of water. So when you start your day with a glass of water, the gut movement starts. After taking a glass of water, you should take slow walk or you should start a deep breathing exercises to start to stimulate the gut movement. Then after taking a slow walk, and after you have passed a good uh, uh, after you have freshened up properly, you should start your day with a low FODMAP diet, which includes avoiding high sugar foods. If you are addicted to taking tea just in the morning, you should just change it to this thing that you start taking it after taking a breakfast. This will cause less GI irritation, and this will definitely help you a lot. And then your day should start with some slow breathing exercises and meditation for minimum 5 to 10 minutes. This help to regularize your system, your ball, to start to get freshen up and start your and helps you to start your day with a fresh kind of feeling. Thank you so much for the patience listening. And before I end, I just want to wish you all a happy new year. Then my thank you note will end with the 5 things you should incorporate in your daily lifestyle to avoid getting into IBS like thing. First thing is that you should make sure that your bowel movement is regular. Second thing is that you should focus more on plant-based diet, because plant-based diet has phytonutrients that decreases the gut inflammation, which has a very important role in causing IBS. Then you should, if you are stressed, then go for a proper stress management, because the stress, if continues for long, will always lead into some of the problems of IBS. A regular physical activity is must, so include a outdoor physical activity for 1 hour per day. A proper sleep for 7 to 8 hours is essential. Make sure that you take proper nap every night, so that next day you start your day with a fresh mind. Then you should avoid too much sugar and processed food. Always restrict them in your diet to stay always healthy. Thank you so much. Stay healthy and fit.
Thank you, Doctor, for sharing such valuable insights on IBS. Your clarity and practical guidance will certainly help both physicians and patients approach this condition with more confidence. To our listeners, thank you for joining us. Stay tuned for more expert-led conversations. Until then, take care and prioritize your gut health.